Here are 5 medications you should always have at home. The first class is the analgesic, also known as pain relievers. And an example of a drug that fall under this class is paracetamol. Paracetamol comes as tablets, it comes as syrups, it comes as injections, but you should always have the tablet at home because you cannot administer the injection to yourself. If it is for a baby, then you can get the syrup for the baby. Paracetamol is very important because it helps to relieve pain like headaches, and you should also have NSAIDs. They fall under this category of pain relievers too. This NSAID stands for non-steroidal anti-inflammatory drugs. And an example of a drug that is an NSAID is ibuprofen or diclofenac. You should have one of these NSAIDs. These NSAIDs are usually used for inflammations or extreme pain that the paracetamol cannot handle. The next class of drug you should always have at home is the antihistamine. Antihistamines are drugs that are used to manage allergies. So if you have allergies from insect bites or from food or from other substances, you can take these antihistamines. An example of a drug that fall under that class is the loratadine. It comes as tablets, and so you can get some tablets and take it when you have this allergy. The third drug you should always have at home is the oral rehydrating salt, also known as ORS. This salt is usually diluted in water. You dilute a sachet in 1 liter of water, and then you take it when you're having so much diarrhea. Before you take the person to the hospital or before you go to the hospital, you can dilute this oral rehydrating salt and start taking to deal with the dehydration you've been facing from either diarrhea or vomiting before you go to the hospital. This oral rehydrating salt is a lifesaver. The fourth drug you should always have in your first aid box is the antacid. Antacids like magnesium trisilicate. These antacids are used for heartburn, for indigestion, or for bloating. The next drug you should always have at home is loperamide, which is an anti-diarrheal. You can use these tablets to manage diarrhea, but that is for a short period of time. Please, taking this drug does not mean you should not go to the hospital. You just take these drugs for immediate relief, and then you move to the hospital so that your symptoms can be assessed to see if you need more medical attention. Thanks for watching.